Now, going over to what are some costly medical mistakes that people can make, knowing all of this here. So, what are some costly Medicare mistakes? One of them is assuming Medicare is free, right? We know it's not. Medicare Part A, usually most of us are not going to have a premium. We are being taxed right now. 1.45% of our income is going toward Medicare. If you were to look at your check, you would see that, plus the employer contributes as well. So right now, you're putting monies into that Medicare Part A. All right. If you earn, it could be anywhere from a 0.9% more, not 9%, but 0.9%, if you're a higher earner. So basically, if you work the necessary 40 quarters, you're going to pay nothing for your Medicare Part A. But, this is going to be totally different with Medicare Part B, right? You're going to pay a premium. Now, this is the same 40 quarters you need to qualify for Social Security. So if you qualify for Social Security, you're going to qualify for free Medicare Part A. Now you say, what if I only work 30 quarters? Then it would be prorated. There's also some rules out there for spouses, and if your spouse qualifies, there's some rules out there for that as well. Now, the base premium for Medicare Part B is different, and it is a per person cost. It's not, a plan that has more than one person like our insurance age 64 and under. Okay, so this is where your premium is $202.90, a month, right, for Part B. And of course, it will go up, depending if you make more money and also how you file your taxes. There's a 2-year look back. And so if you sell your business or if you sell some investments, that premium could change there. Most people are not prepared to spend about 10 to 20% of their Social Security retirement income on their Medicare Parts B and D because prescription drugs, if you buy a standalone policy, if you do that supplement route, there is a premium for that and it's income related for that as well. Kaiser Family Foundation released a study in 2018 showing Medicare beneficiaries' average out-of-pocket spending toward health care was equal to 41% of their average Social Security income. And that's pretty strong considering most people count on Social Security for more than 90% of their income. So when you think about Medicare, it's definitely not free. When you think about Medicare in our insurance we pay now, that we pay for under age 65, we have cost sharing there as well, right? We have deductibles, we have co-pays. Think about Medicare, it's very similar, to that as well. So that's one of the first mistakes that people make is that, Medicare is free. Another mistake is expecting Medicare to cover 100% of your cost. We've already looked at some of that as well. Of course, there's some deductibles and copays. In that Part A, that should say 2020 and 26 there. But in that Part A, when we go into the hospital, it's 1736 every time you go into the hospital. It's definitely got a high deductible there. Okay. Also, keep in mind routine dental, vision, and hearing coverage is not part of Medicare. They drafted this law, in the 60s, and of course, hearing aids were very low in cost. They didn't really realize that dental care was, so important as it is today. So you don't have those costs that are associated or that are involved in Medicare. You have to pay those separately. Basically, 65% of Medicare beneficiaries do not have dental coverage, especially if they don't have those advantage plans there. Now, Part B, again, it's not going to pay 100% of the cost. Your Part B is an 80/20. Okay, so your Medicare Part B deductible, this year, and again, that's should say 2026 is $283, right? So you're going to pay a deductible and then you have to pay this 20% here. So this 20%, there is no out of pocket. Medicare doesn't pay all of the costs there. Another mistake is missing your initial enrollment period. We talked about this already. If you have to have health insurance at age 65, this decision will affect you for the rest of your life. You enroll 3 months before, the month of, 3 months after, and you won't get a penalty. There's a 7-month. Should you wait that long? No. But if Medicare is your primary coverage, meaning you have to have this coverage, you don't have an employer that has 20 or more employees, then you definitely need to enroll in both Medicare Parts A and B. Okay, so that's real important because you will get a 10% penalty for every 12-month period you fail to enroll. Again, this is for the rest of your life there. We talked about if you miss that, you can't just enroll at any time. You have to wait for the general enrollment period, which runs January 1st to March 31st. Now, a lot of people don't worry about Part A because most people enroll into it because it's free, but there's still a penalty there too. It's usually the premiums can be increased by 10%. It's not as tough a penalty as it is for Part B, but there is a penalty. So keep in mind that if you are with a large employer, what can happen here is Medicare is secondary, which means you can stay on your group health insurance. Okay, if you're with a large employer. If you're not with a large employer, you need to enroll in Medicare, both of those Medicare Part A and B at your initial enrollment period. It's primary. Okay, so it's going to be very important that you do that. Now, also, you don't want to wait 7 months, even though you won't have a penalty, because the initial enrollment period, what happens, let's say you enroll 3 months after you turn 65. You won't have a penalty, but your insurance won't be effective until 3 months after you sign up. So if you have no more health insurance and you hit age 65, and you wait to enroll, you may not get a penalty, but you could have some gaps there. So you always want to enroll beforehand so that you won't get a penalty and plus you don't have any gaps. Medicare mistake number 4, skipping Part D without having other coverage. What happens with Part D, and we talked about this with the Affordable Care Act days ago, and basically prescription drugs is considered one of the 10 essential coverages. So let's say that, we have Tom and he says, hey, I'm going to stay on my employer's health insurance and I'm going to enroll in this special enrollment period when I retire. And he's with an employer with 20 or more employees. Well, in his group health insurance, it will have prescription drugs. You have to show that you had credible coverage. We thought that term was done with, right? Not with this particular coverage here. It's done with, age 64 and under. You don't have to show credible coverage. But here, you're going to want to make sure that you show credible coverage Part D, which your human resource person will help you with, because there's also a penalty here if you don't join Part D when you're supposed to join it. Okay. And the penalty is very short. It's only like 60 days or 2 months that you can go without coverage. All right. So, if you do stay on your employer's health insurance, like my husband's planning to do, he's going to have to make sure that he shows credible coverage for Part D so he will not get a penalty. And you need to keep and submit the proof of that credible coverage. Because again, you have 2 months from the time your insurance ends to enroll in Medicare Part D. Should you wait 2 months? No. But again, it's a much stricter penalty than even, your Part B as far as, having those different months that you can enroll. Care mistake number 6, assuming pre-existing conditions don't matter. They do matter. Remember, in your Medigap world, if you decide, hey, I want the Medicare supplement, Medigap, then you need to go ahead and enroll in that within 6 months. Everybody's going to have their own individual effective date because it expires 6 months after your Part B effective date, and then it's gone. You only have one shot in your lifetime to go to Medicare supplement, Medigap insurance without any underwriting. After that, you have to answer health questions and they can rate you or they can also decline you, with that. Another mistake is canceling Part B because you joined a Medicare Advantage plan. I've heard of so many people doing this where, hey, and I think it's the way the agents describe it and just people, they even if an agent describes it really well, sometimes people hear what they want to hear. And so they hear, okay, you can do Medicare Advantage and it takes the place of Medicare Parts A and B. It takes the place as far as the plan is concerned. It's going to look totally different, right? But you still have to stay enrolled in Parts A and B. The government doesn't know if you're going to be in Medicare at age 65 or 66 or 67 or 68 or whenever. So you always have to enroll. The only people that really don't are people that are already on Medicare, like if you have Social Security disability, they will switch you automatically. But you always have to enroll, and because think about the Medicare Advantage. This is where the Medicare Advantage will basically say, okay, we're going to take the place of this, but again, you still have to enroll in parts A and parts B there. Now, this is hard because if you decide, hey, I don't like this Medicare Advantage and I want to go to a supplement plan, you have to be very careful because remember, if you miss your 6 month window, it's very hard to go from a Medicare Advantage to a Medicare supplement. Now, I will tell you, there's a couple insurance companies out there that make that easy for you. So, for example, one of those that I'm thinking about because I do a lot of training with Blue Cross is they have a plan where you can be on Medicare Advantage and go to a supplement plan and be okay with that. Some companies are doing that, but in most of the world there, you have to be really careful if you go Medicare Advantage to Medigap there. All right, so because you get that one shot. Asking your doctor the wrong questions, calling up and saying, hey, do you take Medicare? And they're like, oh, yeah, we take Medicare. They may take original Medicare, and then again, they're going to take any supplement. But do they take this specific Medicare Advantage plan? Some do, some don't. You really need to look at that provider directory. They update that. Make sure you stay on top of that type of thing. I usually send a packet to you in September with any changes in the Medicare Advantage and Part D type situation. So putting all this together does not guarantee issue a lot of people enroll in a Medigap plan without underwriting. Yeah, if you're talking about here, what happens is you will have no underwriting. So let's say that, for example, go back over here. So let's say, for example, we were to go the Medicare supplement route. When you enroll in Part B, whether it's at your initial enrollment period or at your special enrollment period, you only have 6 months after that date to enroll in a Medicare supplement. Now, you can wait past 6 months, but they could rate you or they could deny you. Okay, so this is where it's more of a guaranteed issue situation, is only this 6 months. So if that's what you're asking me, let's say you're on the Advantage plan and you're like, oops, I don't like this. And so a year and a half, 2 years passes, and you're like, I really want to go. Or what you do is you say, hey, I'm going to be on this Medicare Advantage plan where I have little or no premium. Yes, real restrictive. When I get sick, I'm going to go on Medicare supplement if I get really sick. Again, you're taking a risk there because you missed that 6 months of when you should enroll, whether it's your initial enrollment period or your special enrollment period. Okay, so hopefully that cleared some things up. So kind of going through these here, you've got Medicare Part A. This is your original Medicare here. And then you can do a Medicare Advantage plan, which is really Part C, where they bundle Part A, Part B, and prescription drugs. They also usually include vision and dental. It's little or no premium up front. But remember on the back end, you're going to have co-pays. You may have some deductibles. But you do have an out-of-pocket, so you always know what that is. It is more restrictive. Okay, so that particular provider has to take Medicare Advantage, right? Or you can do a Medicare supplement. But if you want to do this to not have any type of underwriting, is when you enroll in your Part B, whether it's here or here, special enrollment period, the clock starts ticking and you need to enroll to get a Medicare supplement within 6 months to not have any underwriting. Now, what that means is you're going to keep original parts A and B. It's not going to, it's going to look like this, but if you get like a supplement policy, like especially like a Plan G, it is basically going to pay all those things in red, that we're concerned with. The 20%, these things in red here. And you will have to purchase a Part D. And again, you got to always do Part D within 2 months. And you'll purchase a vision and dental. So you're putting more money up front, paying for these things, but on the back end, especially if you have a Plan G, you are going to have everything paid for and you have some flexibility there. Okay. So yeah, a lot to keep in mind. Why do people do supplements also is, maybe they have, an HSA, which can pay, some Medicare Part B premiums. Yeah, there's situations where, let's say, for example, Medicare Advantage stops operating in your service area. That's a good point. So I'm glad you brought that up. So they stop offering in your service area, then yes, you have some time to get a Medicare supplement for that. Correct. You have your enrollment period, your general enrollment period, your special enrollment period. There's just so many different avenues to keep in check. So yeah, I see what you're saying now, but absolutely, because that can happen and that has happened before. With that. Like I said, a lot of companies now, well, not a lot, I know one or two companies are making it easier to go from a Medicare Advantage to a supplement plan if you stay with their company. Which why not? That makes sense, right? So you're seeing that come out with a lot of exceptions to the rule type thing. So like someone said, well, I know you can go to a Medicare Advantage to a supplement pretty easy with this particular company. And that's true. More companies are coming out with that, which I think is a good thing because, a lot of people don't know these rules. They don't know the 6-month rule.